Staying open longer despite the fatigue is the first night that some clinics in Singapore are extending their operating hours. This will last for about 2 weeks in a bid to help the healthcare system tackle the ongoing surge in Omicron cases. Now, selected public health preparedness clinics will open until 11 p.m. on weekdays and from 2 to 5 p.m. on weekends. But the Omicron surge is taking its toll on such clinics. Now, Gwyneth Teo is live in front of one such clinic. She joins us now. Gwyneth, tell us about the situation where you are and the kind of challenges that clinics have had to face in preparing to extend these hours.
Yeah, so I'm really standing in front of one of more than 170 clinics in Singapore that have responded to the call to extend operating hours. And right now, as you see around me, it's not that many patients. I think it's a little bit of a reprieve probably for the staff who are telling me that they're extremely fatigued after many, many weeks of seeing extremely high caseloads. Just to give you a sense of that, we've seen almost 20,000 cases every day for this week alone. And, you know, it's really that high caseload that is giving them a lot of additional work, having to swab patients, having to do the administrative work that comes with swabbing patients. The clinic just down the corridor, Holistic Care, also says that they're being treated a little bit like a health ministry hotline, with people calling in and asking, I've got symptoms, I've got no symptoms, what do I do next? And also these additional calls, very strange calls, are also adding again to that burden. So it's really a sense of fatigue, of tiredness, and of really hoping that this surge will go down soon.
We've been working quite hard for the past few weeks or so. We are all actually quite tired, not just the doctors, the staff, and everyone involved. To extend hours is something that we did not really want to do. A lot of us. It was quite difficult for us to convince some of our staff to extend the hours.
So what did help to convince some of the staff? Well, for Island Family Clinic behind me, as you've heard from them, it was hard to convince them, but they're really only adding on an additional hour past their usual 10 p.m. opening time. To do that, they're incentivizing staff with some of the grant money from the government by paying a little bit extra for that extra hour. They're also defraying their transportation costs to make sure that they can get home quickly on a taxi, rest, and then come back the next day again. Some clinics that are adding additional sessions on weekends are saying that they are using the money to try to find part-time help because it's already very hard to get manpower staff for the weekends. But they do know the next 2 weeks are also full of extra challenges, with extra sessions mean extra work, extra disinfecting as well. So they really want to keep going for the next 2 weeks.
Right, Gwyneth, besides the manpower situation that you've just described, dire as it is, we're hearing that there are other issues as well that the Omicron wave has brought up for these clinics.
Yeah, don't forget, it's not only just an Omicron wave. There's also a flu going on as well. And one of the things that doctors are saying, which is quite worrying, is that they're running low on flu, fever, and cough medication. So what they're saying is that they're calling up their suppliers months ahead of time when they thought they could maybe last till the middle of this year. They're already calling them up now, and suppliers are telling them they're actually out of stock of some medicine as well. But they're reassuring. They say they still have buffer, they still have ready supply. They just have to diversify, and again, it's more work trying to look for more sources of these medicine or looking for other types of brands as well. Another situation that Dr. Glenn from Island Family reflected was that he's worried about his chronic illness patients, like diabetes, high blood pressure. These patients are avoiding the clinic because they're worried about catching COVID-19 or the flu. But because they're not coming in, he's not able to keep track that they are taking their medication, that they are on track for their recovery and keeping their condition stable. So he's really hoping the surge comes down and he can call up these patients, has the bandwidth to check in with them and provide them the quality care. Generally, all the doctors that we've spoken to are saying that extended hours are good. Ease the pressure on emergency departments, ease the pressure on their own opening hours as well. But overall, hoping that the cases will really peak in the next 2 weeks, as the Health Ministry has hoped that they would as well, because it's gone past the point where it's sustainable for these frontline healthcare workers.
Yeah, I'm sure everyone's looking forward to the end of the peak. Thanks very much, Gwyneth, for speaking to us. That was Gwyneth Teo standing in front of a public health preparedness clinic this evening.